Hi, my name is Aaron Slattery. I have been an RN for 3.5 years. I am here today at this infection control conference to address the health issue of influenza, commonly known as the flu. The flu is a respiratory illness that can be mild to severe and even lead to death. The typical time when the flu is most prevalent is from October to May. Some people at high risk for contracting the flu are the elderly, young children, pregnant women, cancer patients, and those with chronic illnesses like diabetes and COPD. These illnesses depress the immune system and make people more susceptible to getting sick. The Center for Disease Control and Prevention, or the CDC, is a major force behind the information we have about the flu, its prevention, and its treatment. Their number one recommendation to preventing the flu is to get the flu vaccine. This shot is made up of 3 strains, which are estimated to be the most prevalent for the upcoming flu season. The CDC suggested anyone 6 months of age or older receive the flu shot for their protection against the flu. About 36,000 deaths occur each year from the flu. So the importance of doing everything you can to prevent the spread is obvious. According to the CDC, this 2012-2013 flu season started early and hit us hard. There were 22,048 cases reported from September 30th to the end of 2012. This is 26 times what it was in the 2011-2012 season at that time. So far, there have been 166 child deaths from the flu this year. Of those children, 90% did not have a flu vaccine. The CDC recommends getting the flu shot as early as possible because it takes 2 weeks for the antibodies to develop and begin protecting the body. Also, contrary to popular belief, the flu shot does not cause someone to be sick. Your body can react to the vaccine, like all other vaccines, causing fevers, and you not to feel your 100% best. Because of these circumstances, many hospitals have chosen to obtaining a flu shot mandatory for all employees, volunteers, and students. Many have said this takes away the right for employees to choose. However, the policies have something in place for those who refuse or cannot take the vaccine, like wearing surgical masks. The masks protect the person and those they come in contact with during their job from this very contagious illness. When I was in nursing school, I learned about the Code of Ethics. One part of this code is beneficence, which means to do no harm. This means, as a nurse, you take every prevention to do no harm to a patient. Getting a flu vaccine is a major part of the prevention process. The CDC says this year's flu vaccine is 60% effective. That's all you say? Can you imagine if it wasn't there? That would more than double the number of reported flu cases, taking the total to about 50,000. How many of those people would have become seriously ill or even died? The flu shot may not be 100% effective, but that is a big difference when you are dealing with the whole country. The Joint Commission is an organization that strives to make healthcare organizations excel in providing safe and effective healthcare. One of their top patient safety goals is to prevent infections that are difficult to treat. The flu is a highly contagious, unpredictable virus that has no medication to completely cure it. I would think that would put the flu at the top of the list for difficult to treat. I hope that now you see why policies for getting the flu vaccine in healthcare organizations is necessary to help improve and save lives. With the appearance of these policies, some staff members are leaving their jobs to find a place where they have their rights. But with thousands of people getting sick and dying each year, isn't it worth all your efforts to prevent the illness, especially when you work with those that are most vulnerable every day? Many employees are saying things like, I wash my hands often, I wear masks when I am near a person who has the flu, I keep my area clean and sanitized, and I know when to get treatment. So why do I need to get the flu shot? Doing everything you can is the right thing to do. Having a flu shot, especially when you work in healthcare, reduces the number of flu cases by 60%, keeping people out of the hospital, at their jobs, and caring and providing for their family. Isn't that what we want? Getting your flu shot does not only protect those you care for at work and yourself, but also your loved ones at home. The flu vaccine would protect you from potentially carrying the virus home to your spouse or your children, who are already vulnerable themselves. Thank you for coming today. I hope you can see why getting the flu shot, along with good hand hygiene, avoiding people who are sick, sanitizing surfaces, and receiving early treatment with antivirals can maximize your ability to prevent the spread of the flu. Thank you.